Hello, so I think we're ready to start. Thank you very much for coming very, very early to our AeHIN Hour session this June 2013. I'm Aliyah Evangelista, and I am from the OHA eHealth Information Network. Welcome to this month's AeHIN Hour, our network's online and learning sharing session that happens every second Wednesdays and fourth Fridays of the month, 3 p.m. Philippine time. We're broadcasting from the National Telehealth Center, Manila, Philippines. As I've said, today is June 28th, and it's exactly 3 p.m. in the Philippines. We're very happy to have with us today Sir Scott Teesdale as our speaker on the topic Health Facility Registry. Some quick announcements before we start our session. We're using Cisco WebEx as platform for this meeting. If you are encountering problems on your connection, please log out the session and rejoin the meeting room immediately. Your mic will be muted during our meeting, and if you have questions, you can type it in the chat box located on the right panel of your screen. Click the Raise Your Hand button if you want to raise your questions directly to our speaker. And on the moderator signal, he can unmute you so you can ask your questions directly to our moderator or speaker. And after our meeting, do not forget to accomplish the evaluation survey of this AeHIN Hour. Once you accomplish it, we can send you more information, readings, and other resources on our topic today. And lastly, I would like to request everyone to please stand by for a photo-taking session at the end of our meeting so we can document your virtual presence in this AeHIN Hour. So if you're ready to participate, let's start the session by knowing our speaker. I hope you enjoy the background music of our AeHIN Hour. I'm sorry I cannot cut that music off because I'm outside the office. We are encountering a really major problem in our internet in the office. But anyway, we're so happy that you made it this afternoon. So our speaker today is Scott Teesdale. He's a project manager at INSTED, and he works on eHealth and public health surveillance projects. Prior to his work at INSTED, he served as Health Program Officer for malaria and other epidemiology projects. At the present, he is working in the OpenHIE Information Exchange community that works to help underserved environments better leverage their electronic health information through standardization. So without further ado, and for a more formal session, let's welcome our speakers, Scott Teesdale together with Ed Juzerski. So this would not be a very formal session because what we would like to have this afternoon is to most probably share our experiences and explore for further collaboration and convergence on the use of OpenHIE and learn more from Health Facility Registry. So before I would just like to recap those people who are in our meeting room. We have Zawa Sherpa, I think he is from Nepal, Dr. Raymond Sarmiento from the Philippines, Mr. Roy Consulta, and Steve Ebener and Scott Teesdale. So later this meeting, other countries will be joining us, participants from Pakistan, Bangladesh, India, Indonesia, Sri Lanka, Thailand. So far, we're starting very, very early, and I hope you will learn more from our speakers this afternoon. So I'm turning over to Ed Juzerski. I hope you could share your desktop. Ed, are you on board?
I uploaded the presentation, and you should be seeing it now, correct?
Correct. I've seen it now.
Great, that is good news. Okay, so thank you everybody for participating. And we love the music, which will probably make it easier to understand what we're saying, but it will make it less fun. My name is Ed Juzerski, and I'm the Chief Technology Officer of INSTED. And today, Scott Teesdale, a program manager at INSTED, is joining us. And what we hope to share with you is our work in the OpenHIE Health Facility Registry. Now, there's only a few of us, so I totally encourage you to ask questions as they come up, as we want to have a dialogue with you. We want to share what we're doing, but we also want to learn the work that you're doing that might be related to this, and we want to learn how this could apply to you and what your thoughts is as you hear. So at any point in time, feel free to jump in with the audio or use the raise your hand feature in WebEx if you're familiar with that. We'll be flexible, and there's only a handful of us, so that will work well. And thank you for joining at this time, whatever that is for you. Scott, do you want to?
Yeah, I can introduce myself quickly. Leah, thank you for, again, introducing us, and we are very excited to be speaking today to the group. Yeah, Ed, if you'd like, why don't we get our presentation started?
Yep, you can click on the arrows above of the presentation to swap it back and forth. You go to the tab. There you go.
Okay, great. So today I wanted to begin by sharing a recent Lancet article that was published by Paul Farmer, Jim Kim, and Patrick Porter, I believe. And it's a really excellent article. It's called Redefining Global Healthcare Delivery. While it's not specific to eHealth and integration or facility registries, it does make a very strong point that it's important for the future to really ensure a higher level of value is delivered to stakeholders, to patients, to people who receive public health care or health care in general. That vertical or standalone projects start to be integrated into a shared delivery infrastructure. And so I think certainly in the eHealth world, there's a lot of things that are very pertinent in this respect. Oftentimes in a country, I'm going to move on to the next slide. Oftentimes in a country, there's a lot of different mHealth or eHealth tools and systems that are operating, and they can appear like they're in one health system or that they're working in close coordination with each other. But this isn't always the case. A lot of times systems aren't able to communicate with each other due to all kinds of different issues that can come up. And some of the challenges to integration between eHealth and mHealth systems within a country might be that the outcomes of integrating those systems aren't well understood, or there's not a shared benefit between the partners that's obvious. The partners aren't incentivized to share data between their systems, or the policies, whether it's legal policies or privacy for sharing data, is also constraining the integration opportunities. And then lastly, there's data quality issues can be compromising, as well as the technology themselves, but these are lesser issues, and I think Ed would agree with me that our experience has been that if you can identify common gains or opportunities to share data between groups, it really helps to improve integration between systems. But one of the things that we notice all over is that despite growing eHealth programs and mHealth programs and health data, a lot of times we still see data processes around how data is collected and resources highly siloed, where they don't interact well with each other. They often continue to add on additional functionality just, instead of taking advantage of other resources or digital tools that might be available out there. And so one thing specifically for us is we work with facility registries, and what we find is that their systems can have a lot of different kinds of questions for each other. And this is just a representation of Times Square here in New York City. And if you've never seen New Year's in New York City, this is what it looks like. There's a lot of excitement, a lot of people in the streets, and this could kind of represent the digital ecosystem that we all operate in, where a system might want to ask, okay, where is a certain health facility? And oftentimes if there's no central authority or central location where facility data is collected, different organizations or systems can start to try to answer that. They might need to check a spreadsheet. Okay, let me look and see what information I might have. Different people might have different levels of information, or the identity of facilities can be categorized in different ways. They have different identifiers. The names of the facilities are slightly different. And it can lead to a lot of confusion if there's not a central authority that's helping to manage that. And so I'd like to pass it off to Ed to talk a little bit more about what these inconsistencies in facility data mean and how the facility registry project has come about and some of the things that we're working on currently.
Yeah, thank you, Scott. So while you give me the presenter ball, if we think of all these issues of sharing data, it's really a pity what happens when you have bad infrastructure to share facility data. Facility data is typically not complicated itself, but with bad facility information floating around digital systems, you will get reduced quality of care. The referrals could be wrong or be based on obsolete information, or like make patients go to places that are over capacity. You could have issues with capacity planning where you don't understand the facilities, how the private and the public sector facilities relate. What is the distance that people have to get to those facilities? And both in rural and in urban areas, how does the population match the services available? How to do more efficient supply chains, and so on. Also, having inconsistent data about facilities and how they fit into the admin hierarchy and things like that can lead to incoherent monitoring and evaluation, where across time your indicators don't make much sense as you add facilities, as facilities get identified with different IDs by different projects, and basically you could be double counting results or forgetting about results and things like that. Obviously, then there's impact on specific disciplines such as disease surveillance or crisis response, where having good data up front about how facilities operate and where they are and what they can provide is critical to respond to surges and to understand where your surveillance should be aimed, to understand what is a real spike in a disease versus just like a normal fluctuation. And obviously, especially for crisis response, being able to know what those are and which ones needs to be recovered and greatly accelerate the response. And it's a pity that in most countries, the most reliable facility database is an Excel spreadsheet that only a couple of people know how to get to, and is floating around in emails in obsolete versions. And then like 5 different systems, each one has their own copy, and it's different and it's obsolete and all over the place. So all those problems come to mind, but there's an opportunity. And the opportunity is to really consolidate all that data into a trusted data set that has appropriate curation and data management processes around it so that you can stay a trusted data set, and make sure that it's kept in modern and interoperable tools that help the data get used, that a good tool that helps manage this information keeps track of course, of all the security and process and validation aspects, but also will help that data get used by all the other systems and users that require it, basically allowing you to control it, and at the same time making those consumers of data trust that they're using something that's up to date, that's vetted, and have the opportunity to standardize facility identities in terms of locations, in terms of what type of a hospital it is, in terms of how these things change over time, to document the health services and the programs and the resources that the facility have, and then understand who owns it, which programs are run there, how are they identified by different funders, and so on. Having a trusted data set around all these areas is really an opportunity to get away from the problems mentioned before. as more and more eHealth systems appeared and get put online, more and more the inconsistency of facility data will start causing those issues we talk about. So there's an opportunity to actually avoid those issues by having a good facility registry. And right now, it happens to be a good time to start thinking and to start implementing strategies to put in place facility registries. Facility data is important for the health system, but it's not super complicated, and it's not hard to explain to people what is the value. There's lots of other things that need to be standardized and things like that. But facility data tends to be simple and easy to share. The data dictionaries tend to be very well understood, and the tools and processes to manage them can be very simple, even if spanning the public and the private sector. Other data sets that are very important for the health system as well, such as the standards that are used for terminologies or the provider lists or things like that, are also very valuable, but they're more complex. And this is a good area to start the process of normalizing data management. Then there's an implementation community. Oh, sorry, and there's a question from Ajay here. By ambulance drivers, do you mean their contact details? You were referring to the previous things. We were just saying that, for example, the availability of ambulances, availability of motos, the availability of X-rays and power generators are example things that people want to track in their data dictionary. And we just give it as an example. Obviously, a good tool allows you to define your own data dictionary, and you can track there things about ambulances or not, as you decide. Thank you, Jack, for the question. That's awesome. So we were talking about why is it now a good time to implement a facility registry. The other issue is that now we're having support by funders to create an implementers community through the OHIE project, in which different countries and large NGOs that want to implement facility registries can come together and share requirements, share processes, and get a lot of information, guidance, and documents that really simplify the implementation in their country in one, in one community, in one area. And the support of the funders has been great in terms of helping the countries that have already embarked in this process have a really streamlined, progress to implement the facility registry. Then it's not just about processes and guidelines. There's also tools. There's great tools and code that exist and that have been improving over the last years based on these facility registry requirements that allows you to just take something that already exists, that's proven, that supports 90-something% of the requirements you're likely to have, already supports APIs to integrate with other common eHealth tools, and can be just used off the shelf and can be used with a technical community behind it that will support it. Also, facilities are a good place to start because they can be implemented incrementally. You don't need to start with all facilities in the country with all the data about them. You could just start with public sector facilities and then add private sector once you're ready and have better processes. You could just start with facilities all the way down to the clinic level and maybe leave health outposts for a future census. There's things that you can do that allow you to start with a facility registry process and then add more scope and complexity later on. And that always helps in terms of getting results, getting experience, and having further progress. And then I think quite importantly, the existence of a well-governed master facility list will become an M&E requirement from PEPFAR and WHO soon. So that means that just like international health regulations ask for some types of data, and just like PEPFAR asks for some sort of indicators for the country, we've been working with PEPFAR and WHO, and they've been telling us that having good facility lists coming from the country and showing that those facility lists are well managed, that there's governance processes around it, and that the tools that are like exposing facilities are sharing that is going to be an important requirement. Alvin, welcome. Nice to see you. So these are like good reasons why now is a good time. And let me tell you a little bit about why we started working on this. At Instead, we have been working with these similar tools for a while, and we got invited to be part of the leadership group at OHIE, which stands for the Open Health Information Exchange. OHIE is a PEPFAR-funded project that is geared to helping countries implement health information exchanges that will allow them to have a good platform for their eHealth services. It starts by taking very common tools or very common building blocks and services that are part of a health system and providing communities that support the implementation and the technology design around those. The first 6 areas that are being tackled are the client registry, which keeps track of your population and their health IDs, a facility registry that keeps track of your facilities and where they are and what services they provide, a shared health record, which is like an electronic medical record that's shared across the country, a provider registry, which is the tool that will keep track of your health workers and providers, the terminology service that keeps track of what are the languages and terms and codes that will be used in the country, and finally some integration tools like enterprise service buses that can help orchestrate the business process across all of them. And this is a great set of starting building blocks for eHealth exchange. It's not all the ones you would need, but if you have these 5 building blocks in place, you have a very nice service-oriented architecture to stand on to further put clinic level or facility-based medical record systems, laboratory data, mobile, supply chain, and whatever else you name. Okay, so we have a question from Jai, which is there qualification criteria that could be used for facility registration, periodic review update of their status for them to continue to be on the registry? And let me address that question in a second, Jai. It's a very good question. So what we have as part of the OHA Facility Registry effort is 4 things that are very useful. One of them is that we have communities of implementers and technology providers that are people who do the job of helping build facility registries, implement facility registries, and maintain facility registries in the country, all working together, sharing their knowledge, their experience, and their requirements. And these communities have been really critical in taking the best practices from the real world, from the field, and implementing the system and distilling them, making them easy to consume. Then we have a great process. We have a process that's requirements driven. It's not like you have one tool that anybody should use all the time and one process that everybody should use all the time. We have a set of processes and tools that are really customized to your requirements. And I'll show you some examples of what I mean by that. But the point is that the start of the discussion is, what do you need from a facility registry? We can show you what were the requirements of other countries, and you can compare and contrast, and you can define who are your stakeholders, who are your actors, what are your data dictionaries like, and what are your processes like, and then help configure the tool to support that. And then also the process heavily bets on capacity building, because we believe that the best innovation will come from the countries in which it is implemented. Then it's the right architecture. We're really supporting service-oriented architectures where applications and web services can exchange data and processes amongst themselves, and where these services that manage the data can expose it to different APIs that serve different purposes and provide a good foundation for the future. So you know that the data in there is always trustworthy, and yet it can also be shared with as many systems as possible. And finally, this is all not just conceptual. There's specific technologies, there's tools, there's code that are already used and deployed in many places that help you enact this and give you a very strong starting point. And it's open source, so you can participate and contribute. It's modular. It's very easy to add specific functionality to your country. And there's also like a technical community that's constantly contributing to that. So any questions so far before we drill down into these areas? Great.
Okay,
I'm going to pass the ball on to Scott then.
Yeah, so I'll just say a little bit about the community that we have right now. And we kind of organize around implementations that are ongoing, as well as some of the technical development work, whether it's on the API or around the reference implementation software or standards profiling. And typically we organize Google Hangouts, where we can share screens, we can work on documents together in real time. But also if, for instance, you didn't have a good internet connection that day, we can also call you in over a conference line and connect that way as well. And so just to give you a little bit of background on the implementations that we have ongoing right now. The very first implementation that we had was in Rwanda as part of the RHEA project. And that was the first facility registry as part of the OHIE initiative as we have been operating to date. And I believe that started about a year and a half ago. And then the most recent one is in Tanzania. And we're currently, we've walked through the first 4 or 5 steps of the implementation guide, which I'll tell you guys a little bit more about later. And they're at a state now where they have a nice prototype of their data specifications and user stories already incorporated into a registry tool. And we're just starting to do some iteration based on feedback that we're getting from the users, and we're going to do some field testing as well. And so that's our second implementation that's coming along really well, and we're starting to look to potential additional locations that are also interested in facility registries outside of these 2 now as well. And so, Ed, do you want to say a little bit more about the facility registry, and then I think I'll give a bit more detail about the implementation guide later.
Sure. So one of the outputs of the facility registry community has been to design common APIs to share information about facilities between systems. So there's many standards that we could use, and that are already implemented by the tool, like a GRSS or GeoJSON. But we got together some of the major eHealth and mHealth suppliers, and we discussed as a group what we would like to see in terms of an API for information exchange around facilities. And this group included Instead, it included Dimagi and their ComCare, and TrackNet applications. It included DHIS people. It included Matt Berg, who did Rapid SMS and other tools. It includes technical groups such as ThoughtWorks, who are also working on MoTeX technologies. We had really a broad set of people coming together and helping design an API. And what you're looking at now here that you can see in facilityregistry.org is the documentation of the API that is expected to be implemented by any tool in the eHealth world that wants to consume or expose facility data. So for example, if you are now using ComCare in your country and you implement the facility registry, the facility registry will already talk this API, and ComCare already talks this API. And you could have from one day to the next configuration changes in the facility registry about, for example, which services are provided in blah, blah, blah clinic. And then a health worker using ComCare could do referrals based on that information instantly after that. And these 2 tools would already talk to each other. DHIS would already be able to extract information about the facilities that is maintained in the facility registry and use that as its underlying structure for reporting data about the facility, and so on and so forth. You can get a lot of the initial tools already working together. But more importantly, the API is simple, and it can be implemented by anybody in any programming language. And it's also open source in the sense that we have a community process that I'll show you soon that allows people to make suggestions and recommend changes to the API. And we come together on these hangouts, we discuss the ideas, and then as we decide to, that things are good ideas, we do new versions of the API that incorporate those. Okay? So question for later, I'm going to leave them for later. So let me go, am I the presenter? Yes, thank you, Scott. So Scott, I'm going to forward the slides, but you go ahead and talk to this one.
Yeah, absolutely. So, so this is our just a brief summary of our implementation guide. And so we are working hard towards a version 1.0 of a facility registry prescriptive implementation guide. And our intent for the guide is to provide a framework, not necessarily like a strict framework, but just a process that people can start to conceptualize how to go about implementing a facility registry from the very early stages of conceiving of the idea and the opportunity around a facility registry to documenting specifications, creating a prototype, doing some iteration and testing, and then the ongoing support to make sure that the facility registry continues to operate properly and successfully long-term, and additional integrations can occur. And so our guide is really prescriptive. We focus on user-centered design. We want to identify, with people on the ground, or we want this guide to help users of it to identify the goals and opportunities of particular users, to go through and collect user stories and use that to actually go and create a data specification, or what data elements would be within the registry. The implementation guide also includes job aids and actual examples of artifacts from the current implementations ongoing in Rwanda and Tanzania. And so I'd be happy to share that with the community as you guys are interested. I think we have some links towards the end of this presentation that can direct you to that. But this is our implementation guide as to date, yeah, I think it's a really great tool that can help just kind of orient either people directly interested in facility registries, or interested in a broader open health information exchange implementation as well, how to go about from gathering requirements to implementing different aspects of an architecture.
Mm-hmm. Yes, and there's some questions here, Scott, that I think would be great to address now. So Alvin, for example, was asking, who are the key people to invite for discussions on the facility registry, and should they be managed centrally? So that is exactly the sort of question that this guide helps you with, right? It first helps you to identify what are the goals and the things you want to improve in your health systems by having better facility data, right? And then based on that, and in the landscaping session, it helps you identify what are the stakeholders in your country that would play a role in this. Typical stakeholders are people who have some say into facility registry activation and registration. For example, people would, who assigns the identifiers? Is there a financial or a legal or an insurance implication of adding the facilities? So the first two steps of the implementation guide help you identify what are the people that will have to have a say in the process in your country. And then it has some job aids to help you do an event, a workshop, where in that workshop you can identify challenges and opportunities, and you can also do a sketch of the kind of like what our architecture might be for the data exchange, and also identify people who have different responsibilities in the process of maintaining that data. So this is an excellent point, as you say, to as somebody's saying, actually, as Shakir is saying, to to also bring private organizations that either provide health services or also gather our technology supporters locally, so that they can help the implementation of the facility registry, and they can use these guides to help the process be successful. It's the first time they would be doing it, but they're using the experience of dozens of other people in many other countries. So the hope is that, to help them be successful. And I'll show you the guide in a second so you can see where it's at. Yep, any other questions about this? Yep, I agree. Okay, so let's move on. And the architecture of the tool is another key important part. We want to encourage service-oriented architecture that are modular, that each piece can grow at its own pace, and where the interoperability is clear and allows clear ownership of data and clear management of security. In this case, a facility registry consists of a core that supports multiple APIs, and that can have modules that they can also support other APIs or add other requirements specific to your country. For example, in Tanzania, they have a very special way they want to manage facility identifiers that no other country really needed so far. So it's coded in a specific module, and it doesn't need to affect the rest of the design. And then the APIs are really how the rest of the world interacts with this. There's obviously a user interface that allows data managers to quickly search and manage and curate the tool as well as configure it. But you could also have your add-on applications. For example, I think, Jakir, you mentioned that you had somebody working on a health portal, or no, actually, Jai was saying we're working on a health portal. And the health portal could use these documented APIs, very simple JSON, JavaScript stuff, to query the facilities and expose them in a way that's integrated with the health portal of the country, right? You could also, maybe in your country, it's advanced enough that you have a service bus that's orchestrating different health events. For example, you could have an event that whenever somebody activates a facility, the insurance group gets notified to set up some reimbursement policies. And then obviously there's all the other eHealth and mHealth tools that will interact with the facility data through the service bus or directly through the APIs, depending on the context and the scenario. But this architecture allows you to keep things simple, everything in its place, and everything really easy to program to. And there's you don't need to go crazy extending code in different places to move the data around. Okay. And what we're trying to do is implement all the patterns of enterprise integration out of enterprise architecture that have been successful over the last decade, but in addition, also support all the patterns of integration that have been successful in the web. You know, in the web, you have hundreds of services built by competitors and built by parties who will never talk to each other, all working together and sharing data. And there's patterns that emerge from that that are slowly going back into the enterprise again. And in the facility registry effort and OHA at large, we're trying to make sure that the best of all these practices come together. Because sometimes you don't really have a full control over every eHealth or mHealth system in your country. Sometimes it's done by other private companies or NGOs, things come and go, and making sure the interoperability stays there while tools evolve at their own pace is important, and we're giving a foundation to support that. And what this looks like in your health system means that your facility registry and other building block services could really rapidly facilitate an ecosystem of other tools. Originally, each one of these tools would have to manage its own facility data, would have it duplicate, and would have it inconsistent. With a facility registry in place, all of these can just focus on what they're good at and use service-oriented architecture to move the data back and forth. Okay, hold on 1 second. I'm going to read the questions. So Jay asked, would OHA be interested in helping governments to building APIs for the facility registry? Yes, we're interested in helping you implement the actual facility registry. And for example, if we can help you implement a facility registry system and then help your portal talk to that via the API, that would be absolutely the right thing to do, and we would love to work with you on setting that up. Okay, then another question is, you have a government as well as private organization on this. And we noticed the exact thing that Jakir mentioned in other countries where you have private sectors that have their own data. And having facility registries that can be partitioned, where you have, for example, one set of governance rules for public facilities and other governance rules for facilities managed by other parties, allows you to integrate all that data in one place and kind of keep it together while keeping the ownership and the federation of the of the processes that exist in the real world supported. So we'll move on here. And then obviously there's tools. There's specific technologies that have been built and evolved around these scenarios, but coming from real-world implementations. Actually, the first version of this tool was coded in INSTED's Innovation Lab in Southeast Asia. Some of you have met Shane Sui, who is one of our team members there, and she was a product owner of this in all its implementations in the region. And she's really, really strict about making sure that every feature, every line of code maps to our user requirement. And it shows in the tool in which it's pragmatic in that it does the things that you need it to do, and yet you know, it's full of functionality and flexibility that allows you to do things that originally you thought might be complicated, but over time become needed. It's open source. It's built for scalability and security. We have stress tested it with hundreds of thousands of facilities, and it's part of the design of it to be very scalable, especially for lookups when you have the health system querying this live all the time. Obviously, there's API-based web services exposed through different endpoints are exposed for different purposes. There's obviously it's open source, so there's a development process. You can see the code, you can see the bugs, you can see all of that. It's single command install. You just have a dist package, and it just installs with one command line in your computer and gets up and running. And also we have a cloud instance for easy evaluation, where you can just go online, start using the tool, and while you resolve your hosting issues, and while you resolve your, maybe you need to buy hardware or hire a hoster or something, you can prototype your data dictionaries and work on the cloud instance until you're ready to do your in-country deployment. This is built on a stack that has Ruby. It has Elasticsearch for the reverse indexing, and it uses MySQL as a database, but because of Elasticsearch, all the high performance queries are not handled by MySQL, they're handled outside. And there's also some frameworks for JavaScript and other things that aren't there. But the main core is obviously JavaScript on the client, Ruby, and Elasticsearch and MySQL. Thanks, Alvin. Yeah, exactly. So let me see FYI. All right, so we can talk maybe about the Philippine case specifically later on. And we try to do this. We keep everything as simple as possible, but not any simpler, because then it starts feeling stupid. Okay, so any questions so far? Okay, please. The chat window here is really small, so I'm trying to. Okay, Jai had a question. Try to look for it. Jai, do you mind? Yeah, I can't scroll up, but it's a very tiny window. Hold on. Do you mind repeating your question, Jai?
Hello.
Hello?
I was asking about the quality criteria that we can use.
Yep, so the quality criteria is something that the implementation guide helps you establish, right? Part of the specification and part of the landscape process is basically a workshop to help you define what is your criteria in terms of data completeness, data timeliness, and other dimensions that will let your country decide that facility is a good enough data or not. We cannot tell you what it means to be good enough, but we can show you what other countries think is good enough, and you can start from there and make your own policy. But each country will have to decide their own.
Okay, that will be great. Thank you.
No, thank you. That's great. Okay. So I know that everybody's eager to see real stuff. So let me just share my screen here, and I want to share a number of different things. Scott, in the meantime, is there anything that you think we should reinforce that we missed?
No, I think this is good. I was, hold on. I was just writing a response to Esther about a question she had about how long to get started on a facility registry. And one of the things that Ed had mentioned right as we were getting started was that an incremental approach can be really beneficial to get started in a rapid way, where maybe you start with a finite number of data elements that you would want to store in your facility registry, or even a specific scope. We're just going to start with public facilities, or just start with this one region, and then you can start to expand on that. And add additional data elements as new requirements are identified. Do more thorough user stories, find additional systems to integrate with, and you can build on it incrementally. And I think that's a helpful way to rapidly get started and start to identify that central authority for facility data. And then you can actually use this first version of what you've created to drive demand for expanding it down the road.
Okay, I have one question because it says it's sharing my browser, but I have many browser windows open. What are you seeing on the screen right now?
Ed, I just see a blue screen that says Chrome.
Hello.
How about now?
Oh yeah, I see the Tanzania user stories now.
Okay, great. So ta-da! I had to move the windows around. Sorry for that. So the first, whoops. Ooh, we had the music almost coming back on. The first thing I wanted to show you was the API that was defined by this consortium. And it's very simple. It's all like JSON-based. There will be an XML version coming soon. And it has all the typical endpoints that you need to get facilities, query them, create them, update them, and so on. And it's a very basic API, but it allows already a lot of systems to exchange facility data according to their requirements. That API gets designed by the community through those Google Hangouts that Scott mentioned. And it's discussed in this GitHub site. So if you look at the API and you would like to see issues, or you see a problem with the documentation, or you would like to improve it in different ways, we encourage you to come here and leave your comments and your feedback, and then it will be discussed by the community. As you can see here, for example, somebody said that we needed to have an XML endpoint, and that got assigned to the 1.1 version, and we're all discussing, what are the different implications of that in the GitHub site. Or somebody was saying, how do we expose metadata? And different people are participating there. So it's an open process to evolve the API. Okay, and in that prescriptive guide that Scott was mentioning, which can actually be found here, there's many phases, and each one of these phases will incrementally help you understand your local requirements and define your local policies for the facility registry until you get to the point where you can actually actualize it into tools. And then we have one reference implementation where we have invested into making sure it's well designed and well coded, that you can use to implement those requirements right away. And I'm sorry, there's a question coming in, but for some reason, there you go. I'm trying to open the chat window. Here we go. And you ask, if there's a fragmented system, what would be the effective measure for the HIS? I'm going to answer that shortly. I'm going to look at the previous one. The API design comes after the data model, right? And the answer is no. This API design has like basic core properties that WHO and different eHealth standards others agree are core aspects of facilities, but they're very few. You need to have a name, you need to have an ID, you need to have a basic active, non-active, created and updated, and some form of coordinates. Then typically you will have identifiers that you care about, and then you will have properties that you care about. But every country will have its own different set of properties, right? And let me show you what that looks like. So for example, in Rwanda, they have their facilities registered here. And let's look at one. And I'm probably looking at a very rural one, so it won't have much information. And wow, my whole computer's going slow with the weather. And you can see the fields that they have, all the different attributes of the facility. They're grouped by personnel, geographic information, infrastructure data, services offered, and so on. And each country will have its own subset of information. For example, here in Rwanda, for services offered, they have the services at daycare in their health system, but you could have others as well. Each country will define that. If you go here, let me go back, configuration. Each country will define its own data dictionary according to its needs. So you have your layers which group different areas of information, right? And you have placeholders, but you can define it. For example, in Rwanda, they needed to have two hierarchies, one for the admin hierarchy, right, and one for the reporting hierarchy of the systems used with DHIS. And they have identifiers and things that are specific to their country, right? I can show you, for example, also for Tanzania. Oops, it's not this one. Hold on 1 second. Scott, do you remember which one it is? I don't think it's this one. I'm trying to show you how the different data dictionaries, there you go. So for example, here you have the data dictionaries that is done. So people in Tanzania come in here and they configure the options that are available for their her services in the user interface with no coding whatsoever. So you can go in, you can create an account, and you can start defining your data dictionaries with no customization and no cost for that. So you can really start implementing this right away. And in the case of Tanzania, they have these specific identifiers that they cared about for the facility, and then they have two names, right? All of this will be exposed via the API appropriately, and you can keep adding the fields that you want. Then obviously it doesn't just end there. All this information will be exposed via the APIs, but you will also want to make sure that you have the right security. So in this case, you can see how for different users and different organizations, GEMBI, MSH, the Ministry of Health, and so on, different people get read, update, or no access to different layers of information. For example, some staff might be able to see and edit a bank account associated with a facility for reimbursement, but most people will not be able to see that information, right? And here you can come and you can manage that granularity by the field and the properties, but also by the sites. You can start even saying, this people have access to these sites specifically, and they cannot admin these other sites, which also allows you to partition the private sector and like public sector users. So yes, Alvin, what we're looking at is a configuration view where you can configure your data dictionary, right? And the layers and the fields that are in that layer. For multiple select fields, you can type in, blah, 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 blah. Let me not add that one. Shoot. You can add whatever you want in there. Then you can configure your security. Yep, you can accept pretty much any data model, and I'll show you some advanced features in a second. And then very importantly, it has very good tools for wizards to help you import data that you have in other tools and formats, because sometimes you already have an Excel file or an Access database, and this allows you to get going really easily by mapping the Excel file to your data dictionary, or even just starting from an Excel file and CSV file and creating your data dictionary by looking at the CSV file. We really want to make it easy for people to get started. And then obviously your data is your data, so you can always download all the CSVs with all the information. And sometimes you will want to use the data management tools of this website, but sometimes people want to download the data, work on it with Excel, add columns, do batch updates, and upload the data again. And we really try to make that easy and to make the tool work like you work. Oops, not home. From Alvin asks, is there a standard set of defined properties and attributes for facility data elements? Their answer is yes, there's a minimum set, and then there's like a recommended set, and the implementation guide helps you define of the recommended set which ones are appropriate for your country. So the minimum set is really, really, really minimum. It's like very few properties. It is a name, which I hope we can agree on, whether it's active or not, which I hope that you can determine, and optionally coordinates in if you have them. But you might not need, you might not have these as well. So if you have a name and you can tell me if it's active, then you have a facility. After that, the identifiers are other sort of information you want to have probably, and you might have many identifier systems, because a project might come in and start identifying a facility, and then you have to deal with reports. And then obviously you have your own attributes, number of beds, services, and things like that, or equipment that you might care about. And all of that you define in your own data dictionary. And your data dictionary allows for common fields like text, numbers, yes, no's, options, multiple select hierarchies, references to other sites. So for example, if you could say this clinic refers patient to this other clinic, users, identifiers, and emails and phones. And if you enable the SMS and mobile functionality of the tool, it can use the email and phone for alerts. For example, it could send an alert every Friday to the email of the facility owner, reminding them to update, I don't know, some report or send in some notification. Okay, and all of this tool code is available here in Bitbucket, but we really encourage you to come to the resourcemap.instead.org if you want to try it, because it's hosted in the cloud, it's already running, you don't need to install it. But if you wanted to install it, it's just one command line entry, so it's up to you. So wrapping up the demonstration part, are there any questions about it?
Are these minimum data set available in your implementation guide?
Yes, and not only that, we're working with the different countries so that they actually share their data sets. So I just showed you the data dictionary of Rwanda and Tanzania, and just like they shared their user requirements, we want to share the data dictionary that they use so that you can look at them and start from them, maybe as a design starting point. In addition, we're working with PEPFAR and WHO to make sure that the implementation guide recommends the minimum field that you need to meet their requirements, right? So if you follow the implementation guide and put those things in the tool, you should be able to meet the PEPFAR and WHO facility reporting requirements in the future. Thank you for the question.
Thank you.
Okay. And as you see different, I mean, the areas that we see are all usually very common and all the same. You have some basic information about the facility, like whether the name, it's active, some identifiers. You have where it fits in the admin hierarchy, in the health hierarchy also. Then you get some infrastructure information like building, number of beds, generator, water source, does it have computers, does it have a moto, then health services provided, and then some administrative workflow information like who approved the facility, when was it approved, and things like that. And but you can define your own, obviously. So, Scott, do you want to take it from here?
Yeah, absolutely. I think we were hoping to have a bit of a discussion with folks on the call, and yeah, I actually see Alvin asking one of the same questions we wanted to ask. But a few of the things that we see is common and occurring all over the place is have you experienced that there's multiple facility lists operating in your country, and that they're not standardized against each other? There might be overlap, different names for how a facility is identified, varying identifiers, things like that. Do you have a facility registry already operating in your country? And yeah, we'd be interested to hear from you if either of these kind of questions resonate with you, or you have any thoughts on your own personal context.
Oops, Scott, can you make me the presenter?
Yeah, hold on. Where'd you go?
Okay. Such a very informative session. I think we should have a very good follow-up on the countries who are.
Oh, sorry, we had one more slide where we give the people the resources. Do you mind if we just finish? It's 1 more minute.
Yeah, I think you should send that to me so that I could follow up with the participants this afternoon after they have answered our evaluation.
Hello, Ali, Dr. Andrew. Let's have Scott finish the slides. I think we have time.
Okay, so we still have around 6 to 7 minutes for Scott to continue his slide. Scott, you're still there?
I'm here. Yeah, so
okay.
Okay, yeah, here I'll take over for a second. So the next slide we just wanted to share were a few steps to get involved. We would invite you. We would love for you to join our OHIE Facility Registry community. And the main way we organize our community is through a Google group. We distribute our meeting invites there. We distribute updates to the community. And we have ongoing conversations there. You can ask a question. You could network with other people in the community. And so we would really enjoy your participation in that, and encourage you to join. Also, we would invite you to set up an introductory call with Ed and myself. We would love to talk about your specific context, some of the challenges you might be facing. What level of a facility registry is currently in your country, or what type of facility data you have or requirements that might be out there. And then we'd also encourage you to just give a facility registry a try. You can create an account at resourcemap.instead.org, and you can create a username and a password and create your own collection. And so a collection is just a grouping of points that is similar to a facility registry. And this is a great opportunity to try things out. But we would really encourage you to, and we would love to talk to you. And we added my Skype name as well as Ed's, and we can always chat over Skype or set up a call and share a screen, walk through how Resource Map works, explain some of the other facility registry work that we're doing, or talk about the Fred API as well.
Scott, there's a question from Esther. Higher up, did you see that? Is there a companion tool to facility registry for professionals such as doctors and nurses? Over.
So in OHIE, they call that a provider registry. And we would be happy to connect you to the provider registry subcommunity. So similar to the facility registry subcommunity that Ed and I are hoping to organize and to mobilize, there's another subcommunity around provider registries as a component of the OHIE architecture. And we would be happy to connect Esther to the point of contact for that subcommunity so that she could learn more about that group.
Yes, and I think it would be great to have a discussion with any of you who are interested in the facility registry guide and implementation, because we're also using that feedback to help shape what the provider registry group does later on. So any feedback you have about, oh, this is a good tool, or no, this should be better, or this document could be clearer, and things like that, we will take that and help structure what the guidance is for all of the OHIE projects down the line. The facility registry is the first one to come out that is at this stage. So all your feedback at this stage will not just be useful to you now, but it will also help inform the OHIE efforts that will come in the future.
Great. And Scott, this is Alvin. Hi. I found the mic. What I'll do after this is get a sense of who's interested and get into more about the resource map, and then we'll schedule perhaps a separate session on how to use the resources on an hour that is more acceptable to you guys over there. I know it's an unholy hour from where you're at. And then let's have more detailed walkthrough of the resource map with those interested subset. I think that would be our next step. And thank you very much to Ed and Scott for sharing your time with us. Over. Back to you, Aliyah.
Thank you, Alvin. We appreciate being here. And yeah, we would look forward to any follow-up calls. That sounds great.
Okay, we have a very fruitful discussion. Thank you very much, Scott and Ed. On that note, as Dr. Alvin has said a while ago, we would love to have another session scheduled on this topic. But for the meantime, please, for all who have attended our AeHIN Hour this afternoon, do not forget to answer the evaluation survey form, which we will email to you. Upon answering the form, we will be emailing you the slides of our speaker this afternoon, plus the links and some questions and some follow-ups on our answers to the questions you have posted in this AeHIN Hour. So please do answer the email and evaluation form that I will be sending to you. Thank you very much. We've started on time and ended on time. Again, if you have your cameras with you, I would love to have a screenshot of everyone who have attended this AeHIN Hour. So are you on with your cameras, video cameras? There, I see Dr. Alvin. Sir, where are you logging in from the office? Oh, there we have Scott. We are also. You can see I'm in a coffee shop. I'm sorry, but the internet works well. Ma'am Charity from the Philippines Department of Health is also here. We also have friends from Medilink. So on my count, just say, just have your best shot. Okay, 1. Are you ready? Because this will be posted on our Facebook page. 1, 2, 3, smile. There's, let me just check that if I got it. So also do not hesitate to email us, the Secretariat, for your questions on this session. So thank you very much, Scott, Ed, and the rest of the INSTEAD team. We'll be looking forward to see you on our next AeHIN Hour. Bye-bye.
Thank you. Bye-bye.
The conference is done.